I tell every clinician to do, and I teach this, is take the IAT, Implicit Association Test, that's created and available out of Harvard. Because one of the things that we know is that once you have an understanding of your inherent biases, your own internal judgments that you operate from, once you bring those from the unconscious to the conscious, doesn't mean that you're going to change your bias, but you're more likely to make better choices, right? So okay, this is the group that I really need to be sure that I am providing equitable, evidence-based care because I know I have a bias. Doesn't mean that I'm going to all of a sudden change how I think about them, but I'm going to make sure I'm providing the very same care to them as I would someone that I didn't have a bias. So that's one. Take the IAT. All right. The other thing is to actually assess and practice structural competency in your treatment plans when you are seeing a patient. So what does that mean? Assess for vulnerabilities or inequities in the social determinants of health. Those are avoidable health inequalities that impact outcomes of treatment. So that means, are you actually seeing more than just the diagnosis of the patient? Where are they living? Are they illiterate or not? Do they have any social support? Do they have access to food that they can make better choices? Are they experiencing any type of discrimination? Not just racial discrimination, but discrimination because they have a mental health diagnosis, discrimination because they're overweight, discrimination because they're older. Be able to integrate the social vulnerability tool into your notes. And if you find any areas that need to be addressed, you as a physician don't have to deal with that, but you form partnerships with medical legal partners, social workers, food, policy scholars, etc., to be able to integrate that in your plan, because that is actually going to move the needle in terms of outcomes. You can say to somebody, okay, you have major depressive disorder, you need to take Prozac. I'll say Prozac, that's one of my favorite medications. You need to take Prozac, but if they don't have the money to afford it, they don't have buy-in from the people that directly surround them, so their primary social supports. If they are not in stable housing, it doesn't matter if you prescribe Prozac or not, it's not going to work. Not because Prozac doesn't work, not because the patient is non-adherent, not because the patient doesn't want to get better, but you haven't dealt with all of the things surrounding them that's going to really affect that outcome. So, IAT, looking at the social determinants of health, actually asking about them. You can use the structural vulnerability tool to do that, and then forming the partnerships in your immediate community, whether it be at a family health center, a community health center, academia, or private practice, to be able to intervene. I think that's really important. And then really having a curiosity in terms of what is the literature that exists that I need to read to make sure that I understand what is the approach to culturally informed care. I know for a fact the Jordan Wellness Collaborative, which is my lab, and several other scholars have published a lot on how do you even provide culturally informed care. I'm like, I can't talk about it anymore. Just pick up a book and read it. In the same way that you went through and understood, how to treat acute kidney disease, you need to understand how to provide culturally informed care. And it's not for a lack of information about it. People just are not reading. So do the work, right, in order to take better care of your patients who are not a part of the majority white experience.